A doctor's remorse. Dr. Edward Lawson had always viewed the operating room as his sanctuary. As a talented and esteemed surgeon, he had spent countless hours saving lives and giving hope to the hopeless. However, lately, his own sanctuary was turning against him. Strange occurrences had begun to plague Dr. Lawson, leaving him questioning the boundaries between reality and his own troubled mind. It all began with a routine surgery. Dr. Lawson was performing a delicate procedure when, out of nowhere, he saw the ghostly apparition of a patient he had lost on the operating table months ago. His heart raced, and his hands began to tremble, but he dismissed it as a mere hallucination brought on by exhaustion. However, as days turned into weeks and weeks into months, the visions persisted and intensified. Night after night, Dr. Lawson found himself haunted by the souls of patients who had perished under his care. Their pale, sorrowful faces would materialize before him, accusing him of their untimely deaths. The doctor's once calm and logical mind began to unravel. He developed insomnia, afraid to close his eyes and face the nocturnal tortures that awaited him. Ghastly cries and mournful whispers echoed in his ears, even during the day. Each time he entered the operating room, the ghosts of his past failures seemed to surround him, looming over his shoulder, watching each cut, each stitch. Fighting to maintain his composure, Dr. Lawson sought solace in rationality. He convinced himself that these apparitions were merely figments of his imagination, symptoms of a troubled mind overwhelmed by the uncertainty of his profession. His colleagues, oblivious to his torment, praised his skills and admired his dedication, oblivious to his internal struggle. One fateful night, during an emergency operation, things took a sinister turn. Driven to the brink of madness, Dr. Lawson was convinced that one of the patients he was operating on was another apparition haunting him. He saw the patient's face morph into that of one of his previous failures, a loss that had haunted him for years. The room seemed to spin in a violent whirlwind, as the doctor's panicked mind desperately searched for an explanation. Could he really be haunted by the souls he had failed to save? Or was this just a manifestation of his own guilt? Determined to uncover the truth, Dr. Lawson dove into the depths of medical literature, researching the concept of post-mortem hallucinations. Days turned into sleepless nights as the doctor immersed himself in case studies and scientific journals. His findings revealed that post-mortem hallucinations were not unheard of. They occurred in those who had experienced a deep emotional connection with the deceased, often involving complex guilt or unresolved conflicts. Armed with this newfound knowledge, Dr. Lawson embarked on a personal journey, confronting the ghosts of his past failures head-on. He met with the families of the patients he had lost, seeking redemption and closure. Each encounter sparked a cathartic release of emotions, allowing him to come to terms with his guilt and the role he played in each tragedy. As the years passed, the haunting visions slowly faded away. Dr. Lawson resumed his position in the operating room, but now with renewed purpose and a regained sense of confidence. The ghosts of his past no longer tormented him, as he had learned to forgive himself and to find solace in the knowledge that he had provided solace to countless others. Though the question of hallucinations or hauntings remained unanswered, Dr. Lawson had discovered a truth far more profound. He had unraveled the power of guilt, its ability to consume and tear apart even the most accomplished minds. And in doing so, he had found his own redemption, learning to live with his past and embrace the uncertain future that awaited him as a compassionate and extraordinary healer. Thanks for watching.